Hello, everyone. I would love for my panelists to turn on their cameras so we can see you all and begin the session. I know folks are still connecting. I see Daren, I see Helen, I see Sara. Hello. I like to see Priscilla and Sandra and Adriana. I know they were connected earlier, so I'll wait a few minutes so they can turn on their cameras and we can begin. Sandra, Priscilla, Adriana, just want to make sure we are connected. It's a true pleasure to be here today. For those of you who don't know me, my name is Giselle Cariño. I'm from Argentina. I lead IPPF WHR. We are a collective of about 30 organizations, feminist organizations. You see me wearing, if I was there in person, you would see me wrapping my green handkerchief in the microphone. So you just sit here. It's a symbol of our fight for safe and legal abortion. It's the color of hope. Is the symbol of those who fought before us for human rights, for women's human rights. We just celebrated a big victory in December with the passing of the law for safe, legal, and free abortion in the country. So this is a moment of big challenges for us and a big celebration as well. I am so excited about this panel. This is by far the best panel you can possibly be in. We have wonderful speakers. This is the time where normally I am in bed, but this is a panel to lose sleep over. I feel we are in a moment in which we are creating the future, right? The future in which we want to live. And I do look forward to the insights of these wonderful panelists. I look forward to their agreements and to their disagreements because what it's really important is that we come together to co-create the world we want to live in. This is a wonderful opportunity. I want to thank everyone who is behind the scenes here. You cannot imagine the number of people supporting us, from interpreters to other colleagues from IT and everyone. So thank you so much for working so hard to make it happen. So I now see everyone. I'm going to introduce my panelists very briefly because I know they have long bios and they are online. I will begin with Helen Clark. Helen, former Prime Minister for New Zealand, former Ambassador of the UN Development Programme, a champion for women and girls' rights in SRHR. She leads the Partnership for Maternal, Newborn and Child Health. Thank you, Helen, for being here with us today. Priscilla Usiobaifo, Executive Director for Braveheart Initiative for Youth in Nigeria, a great advocate for young people's rights, including the right to access comprehensive sexuality education. Welcome, Priscilla. I know it's 3 a.m. for you, so I'm particularly grateful for you to join us at this moment. Daren Paul Katigbak, hello Daren from Philippines, an activist on SRHR and Universal Health Care, who is also the Deputy Chair for Y Plus Global, a global network of young people living with HIV. I also have Sandra García from El Salvador. I am waiting for a second because I don't know what is happening with the transmission. And I want to make sure that everyone is properly introduced. And I hope it works. I think it will connect in a minute. Sara García from El Salvador, a feminist human rights defender who coordinates the advocacy work of the citizen groups for the decriminalization of abortion in El Salvador. Let's see if I can see Sara. Yes, perfect. I can see Sara, excellent. I then have Risa Hontiveros, who's not at the moment, she's from Philippines, she's not at the moment, but will join in a little while. She's a community leader, a journalist, politician, and now a senator with a long history of activism for the rights of women and girls, LGBTQ and indigenous people. She will join in a moment. I have Adriana Wesh. Adriana, yes, I can see Adriana, wonderful, great to have you here. Maya, youth activist, affiliated with the National Coordination of Indigenous Women in Mexico. Wonderful to see you here, and with the green handkerchief, excellent. Sandra Castañeda, who is the coordinator, the lead of the Latin American Caribbean Women's Health Network. So welcome everyone. I think the transmission is back, so everyone has been introduced. And as I said at the beginning, the purpose of the panel was to really hear your views on different issues, on particularly the main structural barriers that inhibit guaranteeing women's health and bodily autonomy. In the current context of the global pandemic, you know, we have talked extensively about that in other panels. We in Latin America and the Caribbean are 6% of the world population, 25% of the deaths due to COVID. When you go a bit further and look into maternal mortality of women, extremely high numbers, very concerning numbers in Mexico, in Brazil, in Peru, everywhere where we are following closely. And I think COVID put in front of us all the possible inequalities we have been talking for many years now as a region. So in that context, globally, what measures should government take, you know, to guarantee the right to health for women? And then look at how the feminist movement can work better together with governments, creating alliances, how these alliances, the action coalitions, can really boost transformative and innovative changes. So we have a lot of questions, and we are looking to you for answers. It's going to be wonderful. So I am going to give the floor to Helen so she can share some of her insights with us. Helen.
Well, thank you so much, and fantastic to be on a panel, particularly with so many youth representatives, because this generation of young people, I think, really has the bit between its teeth on these issues. You know, enough of women and girls and youth being disempowered on the sexual and reproductive health and rights matters. You know, young people are standing up, they are demanding action, and just listening to your reading of the biographies of our panelists, I just felt so excited about what they're going to be able to communicate through this global platform today. You know, if we just took that very first question that was to be thrown at us, what are the structural barriers here? It's about power, isn't it? That it's about others wanting to have power over your life as a young person, as a girl, as a woman, as LGBTQI, other people believing they know what's right for you, and trying to take away that self-determination. And I think, you know, fighting for that right for every single human being to determine their future, the services that they need, for those services to be available, that has to be the cause of our lives, really. I often reflect on how different my life would have been as a young woman if, you know, as if I had not been able to go to a doctor in my country and get contraception and have power over my life. That was so empowering to me as a young person growing up in New Zealand. And I would want everybody to have that choice over their fertility and the choices they make about their lives. So I feel that the issues we face in sexual and reproductive health and rights, that they're like they're really the same phenomena that block women and girls reaching aspirations in all kinds of areas. My main field of endeavor was political. I've been one of the ones who's, you know, got lots of glass in my head from going through the glass ceiling. But you just have to tackle those power structures and get the support and alliances around us to do that. And when I say, as I listen to the CVs today, I'm looking at a panel of young people who have alliances, who have networks, who are determined, who are going to make a difference on sexual and reproductive health and related issues. And that difference needs to be made. because last time I checked, still around the world, around a third of women and girls didn't have the access they needed to even basic family planning. This is not good enough, let alone the right to safe abortion. And let me acknowledge what the women fought for and achieved in Argentina. Let us acknowledge how grim things are for women and girls in El Salvador on these issues, and in many other countries too. So a big shout out to everyone on the panel. And I'm really interested in listening to and learning from you. Last point, yes, I have over the last year and 3 quarters taken the chair of the Partnership for Maternal, Newborn and Child Health. We do advocate constantly for women, children and adolescent health. We have a very strong and engaged adolescent and youth constituency, and we want our partnership to speak with and be really so active on the issues that concern adolescents and youth.
Thank you, Helen. And before I move to Priscilla, let me just push you a little bit on the
I think you're muted, Giselle.
Can you hear me?
Can now.
Yeah, no, before we move to Priscilla, I wanted to ask you if you could share a few words about how do we feminist organizations, feminist movements work better with governments to create alliances. You have been someone working at government, working at UN agencies, working in different spaces. If you can share some thoughts about that, or whether that's the right question to be asked, right?
Yes, I just missed a little bit at the beginning. Giselle, could you just repeat it? Some experiences about working within these structures to make these changes?
Some experiences, how can we as feminist organizations work better, create stronger alliances with governments to ensure that we push the agenda forward? Did you hear that, Helen?
Yes, yeah. There's an old saying in politics: the squeaky wheel gets the oil, and we just have to make enough noise so we're not ignored. And that does mean, as you say, building alliances with all the conceivable support and sectors of the society which support these aspirations for full sexual and reproductive health and rights. Look, some governments are very tough going. I recall on my one and only visit to El Salvador, engaging with the president at that time and saying to him, look, as a woman, I have to say, I am horrified at what is happening to girls and women denied the right to safe abortion in your country. But you know, I think we just have to keep trying to break through. Of course, changing those who are in power where we can is extremely important too. You know, many countries have elections, many of them flawed, but there are opportunities for youth and women again to build alliances, to get into decision-making circles and make a difference. And as women, we need to identify who those women and men could be, who will be allies to take these things forward. In the parliament of my own country, I've seen MPs, members of parliament, prepared to pick up key issues of this kind and really push them through and build alliances across parties and across men and women. So it's just sort of fundamental advocacy, lobbying, finding where your allies are, mobilizing, just not going away, you know, staying in their face until you get the change you want. And I appreciate how very, very hard it is in a number of contexts. And we'll hear that reflected, I'm sure, from our panel today.
Wonderful. Thank you for that, Helen. It's about power. It's about the squeaky wheel gets the grease, or something like that in my own translation. Thank you very much. Priscilla, give us your insights.
Thank you, Helen. I would just like to ride on from Helen's input about increasing our voices. And I would like to say that we also need to sustain the increase, because what we see oftentimes is that we do periodic increase. So there is a crisis and we all come out to address it at that particular period. And then maybe some strategies were brought in place to address the crisis. and we reduce the volume again. If we look at most of the issues we are dealing with today, these are issues that were raised during the CPD. These were issues that were raised during Beijing. Not only are we having recurring issues, but we're also currently facing emerging issues. For instance, we didn't have issues of cybercrime, sexual harassment as at when Beijing was held. So in addition to most of the sexual and reproductive health violations, most of the bodily violations that we have, we are also witnessing a new dynamic in some of these violences that our girls and women are facing. In the first 2-3 months of the COVID pandemic in Nigeria, I had to begin to question our state actors about the discussions around domestic violence. And I repeatedly asked the state actors, why do we necessarily begin to feel that our people, our children, and our women are not safe in their homes? It's not COVID that made them not safe at home. It just shows the reality of what the feminist groups have been shouting loudly for years, that our homes weren't safe. Because in Nigeria, for instance, we recorded outrageous number of violations of children who were at home during the lockdown. If we understand that the family is supposed to be the safest place, then why should we record a higher number of incidences of violations of children when they were supposedly safe in their homes? And this just brings us to the issues about domestic violations. And because we are in an African setting where a lot of violations that go on in our homes are seen as home affairs, family issues. And this has led on to the cycle of violence from one generation to another. So as we begin to address most of these challenges during the COVID pandemic, it is critical for us to look at the structural issues that has continued to sustain the denial of access of services to young people, to women, and to every other marginalized groups in our various communities.
Thank you very much, Priscilla, for touching on all those points. I want to hear now from Daren.
Thank you, Giselle. Can you hear me properly? Yeah. I will try to answer your question as much as possible, but I will be discussing 5 points on my part. These are specific and concrete steps on how to have a gender transformative SRHR and HIV response for women, girls, and gender equality. And I think I'm also gonna answer the same question you asked to Helen on what specific measures we can tell the government to address issues on SRHR and also bodily autonomy. So my first point is I think all of us should be reminded that women's rights are women's rights. I mean, women's rights are human rights. It may seem obvious, but I think I should definitely repeat it in this panel discussion. There are a lot of gaps and omissions in the political landscape as of the moment in terms of, women control over their bodies and their lives and their increased individual agency. There are issues particularly in relation to sex and sexuality. There are issues on comprehensive sexuality education, universal access to SRHR services, sexual rights, and the freedom to love and be loved safely. So I think I just wanted to highlight that we should always remember that women's rights are human rights. And then my second point revolves around, putting an emphasis on the different structural issues to gender equality and women's empowerment. And I also would like to highlight that, an investment on women's civil society to support stronger societies, and it will also help in advancing gender equality. Financial commitments have been insufficient, to accelerate progress in sexual reproductive health and rights. And although there are a lot of new diverse funding, most of this funding are getting depleted by the day. And then my third point I would like to highlight is, the power of storytelling and dialogue. I think this is particularly a specific answer to your question on what to tell to our government. Dialogue is an inclusive process that entails learning, but also transforming the way people think, feel, and communicate with others. To a certain extent, gender inequalities exist because of socio-cultural issues. And I think, the power of dialogue and storytelling is very important. I don't know if you've seen my profile, Giselle, but I also work for the Catholic bishops here in the Philippines. And, the church is also quite a male-dominant society. And, throughout my 5 years of working with them, what really works is dialogue, and also the power of the voices of those who are marginalized, those who are underrepresented and unheard. And that what really works for me in my constant communication with the bishops and also with the priest. So again, I'm gonna highlight my fourth point. I think we should amplify and integrate feminist leadership to ensure bold and transformative results. So what do I mean by that? I think besides the leadership and from women's civil society and in true partnership with donors, we should have an opportunity to ensure women and girls-centered interpretation and implementation of such commitments. And we also need to have a data revolution. Besides, the power of, dialogue and also storytelling, we should have a data that is aggregated and also, evidence-based data that we can present to this government, to civil society, and to other multiple stakeholders. And then my last point is, I'm going to speak on behalf of myself. I believe that being compassionate and putting our heart above all is my fifth and final point. I believe that in order to push for gender equality, we have to include our heart along the process. We have to be compassionate and patient. We need leaders, including young people, that transcends to serve others with humility and respect. And we need to create an environment wherein mutual respect is integral. And lastly, I'm gonna end my discussion by saying that leadership is not an affair of the head, but leadership is an affair of the heart. Thank you, Giselle.
Thank you, Daren, and thank you for all your words, but for the reminder that, in communities of faith, there are progressive communities we have to work with, that churches are not monolithic, that many of us, many women don't feel represented necessarily by the hierarchy of the church, and that we gotta work with those who are more progressive, and they could be wonderful allies to our fight for gender equality. Thank you for that. I am going to move on to Sara from El Salvador. Sara, just to say how much, if we could be in person, I would embrace you, to tell you that your fight is an inspiration for all of us, and that we are following it very closely, and you have all our support in this difficult moment. Sara, I want to hear from you.
Muchas gracias para todas, todos por este espacio. Primero que nada, quiero plantear justicia para Victoria. Ella no murió, la mataron. La fuerza policial de Tulum arrebató su vida, arrebató la vida de una salvadoreña migrante. Repudiamos la brutalidad, tortura y su asesinato. Quería empezar con esto justo para referirme sobre esas barreras estructurales que estamos enfrentando en nuestro país, en nuestra región, para poder acceder a derechos que son básicos, que son fundamentales. El derecho a la vida, el derecho a la salud, el derecho a la autonomía. El Salvador es un país que solo en el 2020 enfrentó 130 feminicidios en total impunidad, 541 mujeres desaparecidas. Además de esto, nos enfrentamos a una situación en donde el aborto está penalizado de manera absoluta en nuestro país. Y quiero agradecer también la solidaridad que ustedes están mostrando y que al darnos este espacio pues se está reafirmando. Nos enfrentamos a esta criminalización que está haciendo que las mujeres jóvenes, las mujeres que viven en situación de pobreza, vayan del hospital a la cárcel y que se enfrenten a condenas de hasta 30 años. Quiero referirme para hablar de esta discriminación estructural, de esta discriminación interseccional. Quiero referir sobre el caso de Manuela, una mujer que enfrentó toda la violencia de Estado, quien fue denunciada del hospital en donde ella estaba solicitando ayuda. Manuela se dirige al hospital a solicitar atención médica y lo que recibió fue una denuncia. Fue denunciada manifestando que ella había abortado producto de una infidelidad. Cuando ya estaba siendo procesada, se le impone una pena de 30 años sin ninguna garantía judicial, revelando el secreto profesional y arrebatando sus derechos. Le imponen una pena de 30 años y cuando ya estaba en la cárcel se dan cuenta que lo que realmente tenía era un cáncer linfático. Manuela pasó sus 2 últimos años de vida privada de libertad y murió esposada a una camilla de un hospital público. Murió lejos de su familia, dejó a 2 hijos en orfandad. Y estamos luchando porque se haga justicia para Manuela. Hemos hecho una lucha muy larga, el caso ha llegado a la Corte Interamericana de Derechos Humanos. Recientemente, el 10 y 11 de marzo, se realizó la audiencia pública sobre su caso, sobre su historia. Estamos pidiendo, por un lado, justicia para Manuela, para sus familiares. Estamos exigiendo medidas que sean integrales de reparación, porque les han arrebatado también a su familia. Estamos exigiendo que se pueda limpiar su nombre y que se pueda dar a conocer la verdad de lo sucedido. Además de esto, estamos exigiendo medidas de no repetición. Y eso tiene que ver con que pueda generarse cambios en las políticas en temas de salud sexual y reproductiva, para que esta discriminación interseccional por ser mujeres, por ser jóvenes, por vivir en situación de pobreza, no vuelva a ocurrir. Por eso nosotros decimos Manuela, justicia y esperanza, porque nos da esperanza, sabemos que es un momento histórico para nuestro país, nos da esperanza y creemos que va a ser muy importante para nosotras, para toda la lucha, para cambiar de manera estructural todas estas violencias que estamos enfrentando. Sobre todo porque el caso de Manuela no es el único, estamos hablando de un tema y una problemática que es sistemática. Del año 1998 al 2019, nosotras identificamos 181 casos de mujeres que han sido criminalizadas, que han enfrentado este tránsito del hospital a la cárcel, en donde la justicia patriarcal pues les arrebata sus derechos reproductivos, sus derechos sexuales. Y en el caso concreto de Manuela y de los casos que acompañamos, pues tiene que ver con un Estado que falla, que le falla a las mujeres salvadoreñas y que le falla porque también nos están negando la educación integral en sexualidad. Para comentarles, solo el año pasado se registraron 494 embarazos en niñas de 10 a 14 años y 12.287 en niñas de 15 a 19 años. Son niñas no madres y están enfrentando también esos embarazos que son forzados y que se está enfrentando también a todo un sistema que es hostil. quiero hacer énfasis en estas barreras y en estos obstáculos, porque nos estamos enfrentando no solo a la violencia del Estado, no solo a la violencia de este sistema, sino que también nos enfrentamos a toda la lógica de los grupos antiderechos que están generando diferentes situaciones de riesgo para las que somos defensoras y están generando también situaciones de acoso. Entonces, sí, el llamado que hacemos, y ahí también retomando algunas de las preguntas que hacían, es a esa solidaridad y a esa unidad que es importante que construyamos como feministas, esas alianzas feministas para poder, por un lado, hacer una denuncia y colocar los ojos de la comunidad internacional sobre El Salvador, pero también es una oportunidad este momento para profundizar todo lo que estamos haciendo, todas las luchas que estamos construyendo. Creo que es fundamental que sigamos profundizando estas redes de sororidad, de solidaridad, de denuncia colectiva. Y creo que una de las frases que desde la iniciativa mesoamericana de defensoras se menciona de manera constante es: las redes salvan. Y creo que al final de eso se trata, de entre todas construir, entre todas de alguna manera acuerparnos ante estas situaciones de hostilidad, de violencia, pero sobre todo de casos tan tales como los que le ha sucedido a Manuela, como los que ha sucedido a Victoria. Muchas gracias.
Thank you, Sara. All our solidarity is with you, a virtual embrace. Count on us. And one is left wondering how one partners with a state that systematically produces human rights violations on women in this way, right? In a region where we kill the most human rights defenders in the world. So thank you for your work, and we stand with you. I want to give the word to Risa, who I introduced in absentia. And I see her here, so welcome. We want to hear your insights.
Thank you. Gracias, Giselle. Buenos días a todos. Bonjour. My Spanish and French is not as good as your English, dear sisters and allies. So I'm sorry, I just came in, so I'm not quite sure where in the forum or the conversation we are now. Please just allow me to begin greeting. Yes, Giselle.
No, it's free flowing, so share your insights and about any of the questions posed. We right. Look forward to hearing your perspective.
Okay, thank you. Gracias, Giselle. So first of all, to all the sisters here and all the allies as well, in spite of everything, this pandemic and the global recession, happy Women's Month to everyone. And Ms. Helen Clark, hello, how nice to see you again here. So happy Women's Month, dear sisters. Maybe I'll share just first my reflections on the first question about the main structural barriers. I begin with the Me Too movement, which was really a signal movement that shone a spotlight on the barriers and also leads us in the way that that we can dismantle it. So the Me Too movement is a cultural phenomenon that not only reveals a violence towards us women, whatever our soji, whatever our sexual orientation, gender identity, and expression, but a violence towards women long silenced and therefore also remains unheard. In a way, it's a violence that has for so long been made invisible and pushed into the silence. We women have come so far. We can take positions of power, more spaces, we're guaranteed more rights, but ironically, also because of these achievements, the ways that we are still structurally oppressed in some way have been rendered taboo. So that irony, that our struggles and our victories so far have been used against us in a way to invalidate the other ways in which many of us women are in many ways still structurally oppressed. So his story and not her story as well, and non-binary individuals' story as well. His history is still the blanket and general narrative of humanity. So it's not only victors in battle who write history and so-called losers who are rendered invisible, but victors in the gender wars have been writing history since the dawn of the written word, and our history has been rendered invisible. The stories of everyone else outside history, women and non-binary individuals, are therefore considered too different, too special, exotic, and therefore our rights are still not perceived as basic and inherent. Sometimes they're ghettoized. They're not considered as part of the norm of what is human. Because our bodies are never perceived as fully our own, therefore policy will continue to control women's health, as we saw before the pandemic, as we see now, especially in the pandemic, and probably we'll see even in the so-called new normal. We're still struggling to design it as a better normal, also for women and non-binary individuals. But the jury is still out on that. The debate is still to be joined. The debate is still probably to rage. Because our bodies are never perceived fully our own, policy will continue to control women's health, which is in so many ways our freedom. Our health is our freedom. This control of women's health is to aid in the narrative that we are a luxury and accessory to men, rather than, as I mentioned earlier, a true part of the wholeness of humanity. And I guess that's also behind that artificial divide between so-called productive work and so-called reproductive work, that in later incarnations of our women's movement and women's voices, we are challenging as a false dichotomy. So the fight is still unfinished, and it's an ongoing cultural challenge, as well as, of course, political and, of course, economic. A cultural challenge to insist on women's, our real place or places. Policy plays an important role in the reflection of a society's values. That seems obvious, but gosh, we need to keep on saying it every time we fight for women and other gender bills or policies, and thrown back at us are the same old ancient dinosaur-like arguments. And so that's why we need more women in power, and why we need male allies who will reflect this in the policies they legislate, or in the policies which they will support us to legislate. So my initial sharing, Giselle. Gracias.
Wonderful. Thank you very much. Thank you very much, Risa. And I have a question that I will put in the parking lot, because your analysis made me think, not only how do we get more women and gender diverse people in power, but how do we get feminist women and feminist gender diverse people in power? So let's park that, and I'll move to Adriana. I want to hear from you, Adriana, your views.
Malop akap titulaklish, incabae Adriana Wesh. Muy buenas noches a todas, todos y todes. Mi nombre es Adriana Wesh y yo formo parte de la Coordinadora Nacional de Mujeres Indígenas de México, soy maya, y también formo parte del Enlace Continental de Mujeres Indígenas de las Américas. Yo quiero comenzar como compartiendo que tan solo en Quintana Roo hay 27 mujeres desaparecidas con alerta activa, y de las cuales 21 son menores, y 13 mujeres desaparecidas más con alerta alba en la zona sur de Quintana Roo. ¿Y por qué quiero hablar sobre esto? Justo lo que compartía también la compañera hace un rato sobre el feminicidio, y sobre más bien los feminicidios que han sucedido tan solo en este fin de semana. Y esto solo son cifras en Quintana Roo. Y en las estadísticas, las niñez, las juventudes y las mujeres indígenas estamos invisibilizadas. Entonces somos muchas más. Debemos considerar que para garantizar los derechos sexuales y reproductivos hay otros discursos que tienen que traducirse a acciones, porque si no podemos acceder a los servicios básicos de salud ni a la justicia, difícilmente podremos acceder a nuestros derechos sexuales y reproductivos. Y si somos mujeres, juventudes, indígenas, afrodescendientes, con discapacidad, de las disidencias o de la diversidad sexuales y más, todavía nos atraviesa racismo, la discriminación y la criminalización por vivir nuestra sexualidad de forma libre, autónoma e informada. Entonces, estas son como las barreras y toda la desigualdad estructural que nos atraviesa como juventudes y mujeres indígenas. La falta de inversión en los servicios de atención primaria de salud pública, así como el déficit de trabajadores sanitarios calificados y capacitados con perspectiva intercultural, con perspectiva de género, reducen aún más la posibilidad de acceder a estos servicios. Y además enfrentamos múltiples formas de discriminación, de violencias y de estigmatización con respecto al acceso a la atención sanitaria. Entonces, la pandemia por COVID-19 visibilizó y agudizó las desigualdades estructurales existentes y nos presentó un panorama donde no existen políticas públicas para garantizar el acceso a la salud de todas las personas. En México se visibilizó el sistema de salud precario que nos discrimina, que no tiene perspectiva de género, pertinencia cultural ni interculturalidad. Entonces, algunas acciones que creo que son importantes que el Estado pueda como garantizar o llevar a cabo es justo priorizar y crear mecanismos para garantizar la salud integral, mental y sexual con perspectiva de género, con perspectiva de juventudes e interculturalidad, de tal forma que ésta sea antirracista, anticolonial. Debe garantizar y destinar presupuesto para el acceso a la información y materiales amigables para adolescencias y juventudes en el ejercicio de los derechos sexuales y reproductivos. Y esto implica también que esta información sea traducida a nuestros idiomas, a los idiomas indígenas. Se debe capacitar al personal de salud para brindar una atención libre de prejuicios y estigma, con perspectiva de género, brindando atención integral en los servicios de salud. Y sobre todo, deben garantizar que las leyes y políticas públicas respeten y promuevan los derechos humanos y la autonomía progresiva de adolescentes y juventudes. También necesitamos que se genere y transparente la información en temáticas de embarazos en adolescentes, acceso a la salud sexual y reproductiva y la violencia, y que podamos acceder a abortos y avanzar en la garantía del derecho a decidir en todo México. Debemos garantizar y respetar los derechos del... También se debe erradicar la violencia obstétrica. Y de igual manera, es importante tener en cuenta que acceder como a la salud integral debe ser con políticas, programas y presupuestos que tengan perspectiva de género, perspectiva de juventudes, derechos humanos y sobre todo interculturalidad. De tal manera, y lo digo otra vez y quiero enfatizarlo, que podamos acceder a ellos sin discriminación, libres de violencias y con pertinencia intercultural. Entonces, yo creo que esto es como muy importante mencionar, sobre todo que nosotras estemos visibles en toda esta data estadística como niñez, como adolescencias, juventudes y mujeres indígenas. Y bueno, quisiera comentar también un poco acerca de esta pregunta que a mí me causa como algo, es de cómo podemos los movimientos femeninos, feministas, contribuir y generar alianzas concretas, ¿no?, con los gobiernos. Yo creo que el movimiento amplio de mujeres y el movimiento feminista, los movimientos feministas, hemos tratado de generar estas alianzas con los gobiernos y son ellos que incumplen como todo esto que pedimos, ¿no? Se hacen estos acuerdos y ellos rompen los acuerdos. Entonces, ¿qué se necesita? Bueno, se necesita que ellos garanticen que van a llevar a cabo estas acciones. Y creo que es algo que hemos comentado como mujeres y como juventudes. Queremos que esto no solo sea un discurso, no queremos que siga solo en un papel, sino que esto se traduzca a acciones concretas en lo local, en lo regional, en lo nacional y en lo global. Porque sin este compromiso no vamos a poder acceder y no vamos a poder vivir como libres de violencias y tampoco vamos a poder avanzar en la igualdad de género. Y por último quisiera comentar que nosotras como mujeres indígenas también estamos alzando la voz. Y entonces no queremos que otras personas hablen por nosotras. Queremos nosotras estar en estos espacios hablando por nosotras mismas, desde nuestras realidades, desde nuestros contextos y desde lo que nos corresponde. Muchas gracias.
Thank you so much, Adriana. We hear you. It's wonderful to have you here. Thank you for the reminder that safe and legal abortion cannot depend on your zip code. I see a comment in the chat. that needs to be for everyone. Thank you for talking about true accountability. I think it resonated a lot with me because, you know, we are a region full of law and policies and little money behind it. So I think you really put the finger on what it matters. And finally, thank you for reframing the question. Maybe the question was poorly formulated. Maybe the question is, how can the government work better with us? Not all the way around. So thank you for that. I want to hear now from Sandra. Sandra, where are you? Here, Sandra, go right ahead.
Gracias, Giselle. Yo quiero saber si estoy en el canal correcto para la traducción. ¿Sí?
You are,
Okay,
yes.
Gracias. Bueno, muchas gracias a todas las compañeras que han hecho posible este foro, sobre todo a quienes estamos acompañando esto, para algunas que es muy tarde en la noche. Para hablar de los derechos sexuales y los derechos reproductivos, creemos que es importante también analizarlo desde, en conjunto con otros temas como la educación y temas como la familia, porque en los últimos años estas han constituido una de las áreas donde mayor se concentran las dificultades para superar las influencias regresivas en materia de reconocimientos de derechos de las mujeres desde un enfoque de progresividad de estos. Los sectores conservadores y los sectores fundamentalistas, a través del cabildeo abierto sobre tomadores de decisiones en nuestra región y sobre los medios de comunicación, han levantado enormes murallas de pensamiento, con lo cual han terminado impactando a todas nuestras sociedades en su conjunto. Lo más grave de esto es que en la base de la argumentación de todos estos sectores existe una férrea negación a reconocer los principios básicos de todas las generaciones de derechos humanos y de manera especial aquellos que garantizan la autonomía y la dignidad de las personas a partir de la generación de condiciones para tomar decisiones sobre su vida, sobre su cuerpo, sobre su sexualidad, sobre su reproducción, lo digamos cuya importancia radica en que estos son connaturales a la salud y al bienestar de las personas y por tanto terminan siendo un asunto de salud pública que requiere una particular atención, sobre todo en estos momentos de pandemia. Y nos referimos a estos temas como, por ejemplo, la provisión de métodos anticonceptivos modernos, de antirretrovirales, de otros insumos de salud sexual y reproductiva, incluidos los artículos de salud menstrual, porque son centrales para la salud de las mujeres, para el empoderamiento, para el desarrollo sostenible, sustentable de ellas. Y porque cuando se ven afectadas la cadena de suministro, se ven afectadas de manera severa los derechos, su salud y su integridad, que se expresan en embarazos y partos no deseados o de alto riesgo, en contagio de enfermedades de transmisión sexual, complicaciones de personas VIH positivas, embarazos no deseados o no planificados, abortos inseguros, y lo que está básicamente en nuestra región ligado a la disfuncionalidad que estamos viviendo en este momento de los sistemas de salud. Estamos viviendo en este momento un encuentro mortal entre los discursos fundamentalistas que niegan sus derechos y la disfuncionalidad de un sistema de salud que se ve copado por la atención de la pandemia. Y esta disfuncionalidad y esta presión excesiva que hacen los grupos antiderechos sobre nuestra agenda de derechos tiene unos impactos graves, gravísimos en nuestra salud y que se ha venido expresando durante esta pandemia en mortalidad materna, incremento de la mortalidad materna, muchas necesidades insatisfechas de anticoncepción, aumento de embarazos no deseados, aumento de abortos en condiciones de riesgo, etcétera, etcétera. Así que nosotras creemos que los gobiernos deben tener una respuesta fuerte, una respuesta contundente en materia de fortalecimiento de los sistemas de salud, en fortalecimiento de los programas y de las políticas de salud reproductiva. Hacer frente a los obstáculos y a las barreras a través de acciones para facilitar el acceso de las mujeres y las niñas a los servicios, incluidos servicios de apoyo psicosocial, especialmente a las mujeres víctimas de la violencia que se han visto especialmente afectadas durante la pandemia. Pero sobre todo, creemos que nuestros gobiernos deben establecer compromiso político con la sociedad civil, con escuchar y atender a la sociedad civil, pero no cualquier sociedad civil, aquella sociedad civil comprometida con el avance de los derechos de las mujeres, con el reconocimiento de las mujeres en toda nuestra diversidad, con la decisión política de romper ese acuerdo con el patriarcado, de no perpetuar las violencias, de reconocer las diferentes formas de violencia como un problema político, un problema público, de comprometerse, no solo de palabra o de corazón, también con políticas, con recursos, con dinero, con el fin de la impunidad. El respeto a los movimientos feministas, no más criminalización a las mujeres por decidir sobre nuestros cuerpos y permitir que las mujeres también expresemos, sobre todo las mujeres jóvenes, tengan la posibilidad de expresar su digna rabia sin que sean criminalizadas por ello. Gracias.
Thank you very much, Sandra. Thank you all who spoke about violence. Thank you for the reminder that patriarchy is a system of oppression, operates with others, racism, colonialism, to oppress everyone really, and particularly women and girls and gender diverse people. Thank you for that, Sandra. We have a few more minutes and a million questions. I'm going to post them all, and any of you who want to jump, take a stab at it and leave us some take-home message are welcome to do so. Have a question specific for Helen. Talk to us about New Zealand, not only the political leadership you have played on SRHR in the world, but also any financing that exists for the SRHR movement. We had the question, we also had a question for Adriana to talk to us about the cultural fluency needed to work with indigenous folks when in their cosmovision there is a strong grounding for the value of life. And how do we work with abortion? How is this compatible with some of the values? And if you can shed some light about that. And I finally have the question of, Helen began talking about power. How do we get feminists into power? Anyone would like to use a few? We have maybe 5 minutes to close. Helen, take it away.
Yeah, your sound was very, very poor, Giselle, but I'll see if I can sort of pick up some of the threads of what you said. Firstly, on that last point of how to get feminists into power, it is, of course, true that not every woman who ends up in political decision-making is a champion for women. And so I think we need to be a little discerning with our support and work to support and bring through women who really will stand up on these issues, not women who stand for an oppressive, repressive status quo. And we've heard such incredible testimony today, especially from El Salvador, about how bad that status quo is. So women who defend that really aren't doing any of us a service by being in decision making. But one set of points I'd like to make now relate to what the pandemic has exposed about access to sexual and reproductive health services. The WHO did a survey of 105 countries, and I honestly can't say whether that 105 was representative or not. But it revealed that a third of those countries had seen disruption to sexual and reproductive health services during the pandemic. My view is it's probably higher than that. But the consequences of that, as we know, women denied access to family planning, to safe abortion, where that was possible under the law, and of course it should be possible everywhere, and then to women needing prenatal care, assisted birthing, and also postnatal care. So, you know, out of this disaster of disruption to the services, we do expect, and UN Population Fund has documented this, we do expect more maternal mortality. We can also expect more infant mortality from and stillbirths, and of course the disruptions in services go to disruptions in immunization, to the delivery of essential drugs for HIV, and many other conditions as well. But at PMNCH, a Partnership for Maternal, Newborn and Child Health, we have been, from around the middle of last year, really pushing a call to action, 7 points, demanding that governments make sexual and reproductive health and rights services essential parts of core services. You know, there have to be business continuity plans here. You know, we know that adverse events come along, and these services have to have resilience built into them. They can't just be optional extras that when there's a disaster, that they're not there. These are critical, essential services. We've also called for the views of women to be very much taken into account in designing pandemic preparedness and response. We want women engaged in this decision making. We see so often in the task forces which have been overseeing national responses, very few women on them. We want these critical women-dominated professions in the health sphere to have a say. You know, I've personally held consultations with global nursing community, global midwife community, sexual and reproductive health and rights community, with my other hat of co-chairing the independent panel on pandemic preparedness and response, which the World Health Assembly asked for. And these professional groups are telling us, you know, no one's asking us, you know, how's this pandemic impacting on us? How's it impacting on the women that we serve? So, you know, a lot of issues are exposed by the pandemic. Others have commented it's exacerbated existing inequalities. We see women losing jobs and livelihoods at a far greater rate than men. It's been a disaster, but you know, we must out of this take that sexual and reproductive health services are a core service that must be provided at any cost at all times, because you know they're so essential to the you know, well-being and health of girls, women, youth, our communities. So I think that would be a point I would want to very strongly lodge.
Thank you. Essential services indeed. With that, we are going to close. We have less than a minute left. I want to thank all of you, all the panelists, everyone for being engaged, for being here. We need another hour, definitely. I want to hear from you more. It's been lovely, really. And I hope we can continue working together in global solidarity and stand together for women's rights. Thank you very much. Take good care, and we'll continue.
Thank you.
Thank you.